Hi everyone. So today we are going to talk about organ transplantation. It's something that everyone is scared of. It's something that people need sometimes, but they do not have any sufficient information. If you are someone who's looking for organ transplantation, be it kidney transplantation or liver transplantation, and have need some relevant information as to where you can go, what's the criteria, what all information you need before you make up your mind to undergo organ transplantation, then this video is for you. So transplantation of any organ which is taken from a living donor or a deceased donor is known as organ transplantation. It could be a transplantation of the liver, it could be transplantation of a kidney, it could be heart transplantation, it could be lung transplantation. So there are different rules and regulations in each country that dictates how a patient can actually avail organ transplantation, whether it's from a living donor or from a deceased donor. Most of the countries around the world, they allow organ transplantation from a deceased donor for its own foreign nationals. So for example, a French national can actually approach a hospital that performs a lung transplantation and they can apply for transplantation from a deceased donor. However, that not may be true for somebody who is a national of Nigeria. If they want to go to France to get it done, that may not be possible for them. So the safest, quickest and clinically viable options for all such patients who are on the waiting list or may require kidney or liver transplantation is to get the transplantation done from a living donor. Now, people do have questions as to, who is eligible to be a living donor, whether they can have a living donor from any other country, or maybe if living donors are available, or who from within their family is available. So it's completely illegal in all of the countries to avail a living donor in exchange of money. It's always preferred by all the governments of the country as per the ethical laws, organ transplantation laws, that it's either somebody from within your family up to the fourth generation who can donate you an organ, be it kidney or liver. Even we have programs for living donor lung transplantation available as well. Or it could be somebody who's very, very close to you, who's extremely close to you, extremely close to your family, and you have enough proof and evidence available that yes, they can, you are someone who's very close to the donor. And there are certain tests that needs to be done to check for the eligibility. For example, some simple tests as a complete blood count or maybe a blood grouping as well. There are certain tests which are done for the patient and the donor to check for eligibility, to check whether clinically the donor is eligible to donate or whether the donor and the patient are compatible or not. And our team guides you in identifying a suitable donor, in letting you know whether the donor is suitable or not, so that accordingly you can plan the procedure. We have multiple countries on board that conduct liver transplantation and kidney transplantation, for that matter organ transplantation for foreign nationals, and these are private hospitals. It's also available in public hospitals as well in some of the European countries, Asian countries as well. However, I'm going to talk about some of the top destinations where you can avail organ transplantation if you fulfill the criteria, if you have a suitable donor, if you have the medical reports and summary available. One of the topmost destinations is India, which is very extremely popular for organ transplantation of foreign nationals because of affordable pricing, because of the expertise, because of state-of-the-art hospitals, because of the infrastructure, and because of the clinical expertise which is available in the country. So India is one of them. Then we have Turkey as well, where organ transplantation can be conducted. In Turkey as well, all types of organ transplantations are available. So there are different rules and regulations that that dictate who is an eligible candidate for organ transplantation in both these countries. And you can get in touch with us to know more about what are the different legal rules and regulations, and in terms of documentation, what's the requirement for the patients. Apart from these two countries, we have options available in the UK, we have options available in Singapore, in Thailand, in Colombia, and certain other countries as well, where organ transplantation is available at some of the best private institutes. Now you may ask that there are different destinations where organ transplantation is available, so what's the right fit for you? So this decision is basically made by patients on a plenty of factors, including what's their budget, what costs they are looking at, what's the cost of living, what's the cost of follow-ups, what is the experience of the doctors who are available who perform transplantation, if there is any kind of waiting time, how will the logistics work out, what's the distance between your home country as well as the preferred destination as well. So there are a lot of considerations that patients really have to make before they choose a particular destination. We have a dedicated team available who engages in that kind of conversation with all the patients to guide them, to support them, and to answer their queries as well, so that they can arrive at a decision. So if you are someone who requires organ transplantation, or one of your family members or somebody in your friend circle who requires organ transplantation, and you have plenty of questions regarding organ donation or maybe eligibility or the criteria or whatever test that needs to be done, feel free to get in touch with us on the contact details given in this post, and one of our team members will get in touch with you to engage in a conversation and to guide you and support you throughout your journey. Thank you.